16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
जी आया ना मैं प्रीति प्रवीण एक बार फिर ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦਾ BMC ਪ੍ਰਵਾਸੀ ਵਿਜ਼ਨ ਰੰਗਲਾ ਪੰਜਾਬ ਅ ਕਲਚਰਲ ਹੈਰੀਟੇਜ ਦੇ ਇੱਕ ਨਵੇਂ ਤੇ ਮਨੋਰੰਜਕ ਐਪੀਸੋਡ ਵਿੱਚ ਸਵਾਗਤ ਕਰਦੀ ਹਾਂ। ਗਰਮੀ ਦੀ ਛੁੱਟੀਆਂ ਚੱਲ ਰਹੀਆਂ ਹਨ ਤੇ ਇਸ ਦੇ ਨਾਲ ਚੱਲ ਰਹੀਆਂ ਬੱਚਿਆਂ ਦੀਆਂ ਖਾਣ ਪੀਣ ਦੀਆਂ ਵੱਖ-ਵੱਖ ਫਰਮਾਇਸ਼ਾਂ। ਜਿੱਥੇ ਬੱਚਿਆਂ ਦੀ ਮਸਤੀ ਕਰਨੀ ਵੀ ਜ਼ਰੂਰੀ ਹੈ ਉਦਾਂ ਹੀ ਜ਼ਰੂਰੀ ਹੈ ਉਹਨਾਂ ਦੇ ਸਿਹਤ ਦਾ ਖਿਆਲ ਰੱਖਣਾ। ਤੇ ਜਿੱਥੇ ਖਾਣ ਪੀਣ ਦੀ ਗੱਲ ਹੋਵੇ ਉੱਥੇ ਦੰਦਾਂ ਦਾ ਜ਼ਿਕਰ ਨਾ ਹੋਵੇ ਕਿੱਦਾਂ ਹੋ ਸਕਦਾ ਹੈ। A healthy mouth can be a great asset. Our teeth have such an important role to play in our lives. They help us chew and digest food. They help us to talk and speak clearly. And they also give our face its shape. A smile also has other day-to-day benefits. It can give us greater confidence as well as influence our social lives, careers and relationships. Because of this, it only makes sense to give our oral health the best care possible. A healthy smile can truly transform our visual appearance, the positivity of our mindset, as well as improving the health of not only our mouth but our body too. Normally, the body's natural defenses and good oral health care, such as daily brushing and flossing, keep bacteria under control. However, without proper oral hygiene, bacteria can reach levels that might lead to oral infections such as tooth decay and gum disease. Today, in our studio, we have Dr. Gurpreet Kaur, who is going to talk about oral health with Jacob, Paki, Prarthana and Surya. So, let's go and see what children want to know and what informative tips Dr. Gurpreet has to share with them.
Welcome, doctor.
Thank you.
My name is Surya Kritarth, and I would like to start this program with a very simple question. I have milk tooth in my mouth, so it's already going to fall down after a few days. So should I really need to take care of them?
Yeah, beta, you have to take care of all the milk teeth, even if it is one left or more in your mouth. Because you see, milk teeth just take this, maintain the space for the permanent teeth. If they are going to stay in your mouth longer for years, like you have starting your teething phase from the 6 months till 2.5 years, and after the 2.5 years, from the 6 years, you will get starting your permanent teeth. So from the 6th year till 12, 13 years, you are getting your permanent teeth. So even for this period of time, if you are not taking care of them, if they get decayed, they can affect in many ways. Like if they are getting cavities and they can get deeper, you will have pain, you can have infections, or even sometimes what happens, your permanent teeth which are under the baby teeth, your milk teeth, they can also get infected even before they are coming in your mouth. So, and main function of they maintain the space. You know, like you all guys are sitting now on the individual chairs, you have your own space. If we will keep a bench over here and all of your, what you will do? You will take more space, whatever you feel like to sit comfortably. And if anyone else want to come and sit with you, you need to squeeze. Like same way, the teeth have their own space. On each individual tooth, the permanent tooth will come. We call it successors. Like their tooth successor will come. If one tooth is fallen down, suppose, and the space is there, what will the nearby teeth will feel free. They will move to that space. And what happened? The tooth which was going to come to that particular space, they will get a less space. Then he has to squeeze it out inside, and that will not be fit in that space. So then at that time we need to make a space for that. That's how the braces and all this come. So always it's good to maintain the milk teeth till the end of the time, until unless it is highly indicated or your dentist says like, okay, no, you have to remove it, we don't have any other option for that. Till then it's mandatory or it's compulsory to keep your milk teeth in your mouth as long as possible.
Thank you, doctor.
Yes, doctor. So my question is that sometimes when we eat our food, our teeth, they tend to get stained, or we have a bad breath after we eat our food. Mm-hmm. So why does that happen, and how can we prevent that?
It's a very good question, Vita. Like the thing is this, there is a long list for the bad breath, and for the staining, there are also a lot of reasons are there. So I will give you one basic thing, like always keep in mind that anything which can stain your white t-shirt or white dress can stain your teeth also. So always keep in mind, like anything which is going to stain, which can stain your white dress, can stain your teeth also. So there's a long list. Many food, they have a very, very high in color, very strong color, especially the turmeric ones. So you might have noticed if you're eating something, curry or something that fall on your t-shirt or the dress and it gets stained, it's very difficult to remove that. So many food had that. Many medicines have this side effect. Like give the side effect, especially like if you are having low blood in your body. So I don't know, maybe your mother or father have given you some iron syrup or anybody, that can also stain. Or some basic antibiotics that can also give stains to your teeth or the food. And if you are not cleaning your teeth properly and the plaque layer remain on your teeth, that can also be the reason of stain. So there is a long list for the staining of the teeth. There are so many reasons. So always brush your teeth properly and keep them clean. And if it is not going by even with the cleaning twice a day, then you have to consult the dentist. And there might be some medical reason for that. And for the bad breath also, we start with the mouth. whole body. You know, our mouth is the, I can say it's a gate or the mirror of your body. So like whatever is happening in your body, it's connected to mouth, our whole body. So whatever you are eating, that can give the bad breath, like garlic, onion, sometimes they give bad breath. Or if you're not cleaning your teeth properly, the plaque layer is there, the bacteria are there, they are degrading, that can give the bad breath. Okay? If your tongue is coated, that is very important thing. Like always brush your tongue also along with your teeth. Like it's not always like don't spare it, and brush each and every tooth. Don't choose your favorite tooth. I always say to the kids, like okay, सामने दांत है यही दिखेंगे तो we will just clean them. No, because okay they are you are visible in your smile, but the back teeth are also very important to chew the food. So always brush all the teeth and brush your tongue also. And even after taking care of all the oral hygiene methods, you are properly brushing, you are flossing your teeth at least once a day, you are using mouthwash. Even then, still that bad breath doesn't go, then you have to visit the dentist and they will find out the reason, and or you have to visit the physician, because if you have a cold, you have a sore throat, that can be the reason of your bad breath. And internally, then it goes deeper also, like for the lung infection. There's a long list. So basically, you take care of your mouth first, and if it doesn't help, then dentist will refer you to the physician.
Okay. Thank you, doctor.
I really don't like brushing my teeth twice a day. So should we really brush them twice a day? Is it actually important?
Yeah, of course. It's very important. What time you don't like to brush, morning or the night before going to bed?
Night.
Yeah. Why? Feel lazy?
Yeah.
No, actually, beta, the nighttime brushing is more important than the morning time. You know why? Because when we sleep, if before sleeping, if you will not brush, you eat anything and you sleep, what will happen? Whatever you have eaten, it will stick to your teeth, and it will remain in your mouth for the longer period of time. There is no activity is going on in your mouth that time. You are not chewing, no, you are not drinking water, and our saliva, the flow get very less. So there is dry mouth kind of things in the mouth, and all the bacteria that stick on your teeth, they will have party in your mouth at night. And then because the degradation of the food, and then cavities forms, they form the acids, and like that the cavities form. So it's always highly advisable, highly recommended to brush your teeth at night. Even the morning brush, if you, because of any reason, if you are skipping, that's still okay. It's not, obviously it's not recommended, but it's still okay. Like you can brush later on also. But night, never skip. It's very, very important. Yeah.
Okay.
So all in all, when does this process, this whole cycle of the milk teeth falling, then developing the new permanent teeth finish? Like at what age?
See, beta, for the baby teeth, they start coming in your mouth from the age of 6 months usually. Like from the 6 months onwards till the 2.5 years of age, you will be having the baby teeth. And the process started falling off them, and the taking permanent teeth, they take these places. It's start from the 6 to 7 years of age. It might be little different for everyone. Sometimes it's late for some kids and some children, and sometimes it's early. So usually this is the most common age. From the 6-7 years, the permanent teeth starts until the 12-13 years. You have except the wisdom teeth. Wisdom teeth, they comes around when we call you get wisdom, around 18 years of the age. Like, but it can be changed. Like for some children, it's not necessary to have all the kids will have the teeth at the specific period of time. But this is the roughly time period of them for them.
Thank you, doctor.
Doctor, I have a younger sister. She's 3 years old. So at which age it is safe to use toothpaste?
Yeah, but actually we recommend the toothpaste to be used for the kids when they know how to spit it out. Okay, it's like, because if she can spit at 3 years of age, she know how to spit it out, then it's safe to use it. Otherwise, it's only brushing. We advise to use only the brush for the kids. Okay, and once your brother or sister, younger brother or sisters they have only one of their first tooth, then even your parents must have started to clean them with the like sterile gauze or the sterile cotton. They will just wipe it out. You must have noticed that, like they are not using brush, but after some time they start using brush. But the paste only when the kid or the child know how to spit it out, because they should not swallow it, because it's not good for them. So whenever they know how to spit it out, you can use the toothpaste. Okay?
Thank you.
Very intelligent question.
Thank you, doctor.
Yes, doctor. So my question is that why are my front teeth bigger in size than my back?
These permanent teeth all are bigger in size than your baby teeth, and this is, you feel that these are big. Actually, because your face and your jaw is small now, and because you are at a growing age. So this permanent teeth which has come, it will remain the same size throughout of your life. They are not going to become more bigger. So it comes in the natural size now, their original size, and once your face will grow, your jaw will grow, then it will be in symmetry with the rest of your face. So then you will not feel that like it's bigger than the rest of your teeth. But all the permanent teeth are bigger in size than the baby teeth.
Yes, doctor.
Okay.
Thank you.
So when I was in my 3rd standard, I had a small accident and my teeth got chipped. So how can we fix this problem?
Yeah, it can be fixed very easily, beta. If it is, when you were in 3rd standard, so if it is not discolored, and I can see that it's not even discolored, it's only the chip. It's very common with the naughty boys or girls both. Even I can see Paki's tooth is also chipped out from the front. So it can be easily restored. You know, it's being so many years, if it is not discolored or it's doesn't have any infection, so we can just simply build it up with a simple filling, or we have a lot of cosmetic procedures, and it can be easily we can make it to the original site or make it look pleasant to the eyes. So once you will be grow a little more, and then it can be fixed easily. You can visit any dentist.
Okay, thank you, ma'am.
What is the right age to get braces, and is it necessary to get it by that age?
No, beta, it's first of all, it's not necessary. It's not a necessity to get the braces, because it's many people doesn't need, many children doesn't need at all. Even I never had braces. So it can be the natural, you have the normal alignment, nice alignment, so you don't need it. But yeah, if you need it, then you have to, you must take it around the age of 13 years or latest by the 13 years. But we always recommend to visit the dentist around 9 to 10 years of age, because sometime what happens, some of the things which happen at that age, we call it crossbite or like these things, then they should be addressed at that age as early as possible, because at that age some small problems can be fixed within the 2-3 weeks of time. And if we delay it, then it takes a longer time and more complicated procedures. So it's always better to visit the orthodontist at around 9 to 10 years of age, and then they will guide you like what is the exact age for you or the right age for you to get the braces, if at all it is needed.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
the wearing braces. Is it like what's the correct procedure for brushing our teeth or cleaning our teeth with the braces on?
Yeah, very nice question, Mita. Intelligent question. So you see, with the braces, of course, it's little difficult to clean them because all of your teeth are covering with the braces and the brackets over there. So usually when you are having the braces, that time your doctor or orthodontist will recommend you to use a specific orthodontic brushes that are specially meant for the braces to clean the teeth with the braces. And then they are the comparatively the smaller in size, and you have to make a angle of the 45 degree along with your gums, and in the small portions you will clean first above the brackets are the like the braces which you see above the brackets and the wire, and then once all sides are cleaned on one side, then switch to the other side, and the same way then below the braces also you have to clean. Okay, you have to clean it for the complete 2 minutes. Time period will be the same, but you need to learn the skill to clean them. It's easy. It's not a rocket science that you can't do it, but it's a very easy. But you need to just practice once or twice, and you can do it. But especially with the orthodontic brushes, you can do. And another thing is very good thing is called water flosser. You know, water flosser is like a jet water, and it's instead of thread, you can use that. And with that, it's very, very easy because it's very normal to get the food stuck in the braces. So after the brushing, as we rinse our mouth, and if you have the braces, then you can use that water flosser. Water flosser, in that you will have a very force with a very high force. It's on the water flosser, you can use the water jet, and it's close to your teeth, and clean it. Just bending over the basin, and this each and every tooth you can clean it very nicely. So water flosser is very helpful in the braces, in the patients with the braces.
Yes, doctor. So I have seen that on many toothpaste, the main ingredient is fluoride. So is it actually safe for our teeth?
Yeah, actually it's even safe in a very limited, quantity. Like it's a recommended quantity for the every toothpaste to have that one. And fluoride is a very, very good ingredient for all the teeth, like to save them. For the cavities and for their decay also. In fact, usually I'm not sure, you must have visited the dentist, and when you were very young, that time your parents must have taken to the dentist, and they apply the fluoride application we give them for every 6 months. So that save your teeth actually. So it's in a quantity, there is a typical the quantity that need to be each toothpaste should have. And it's a very, very safe in that quantity, and then it's a very, very good for your teeth also to save them.
Okay, doctor. Thank you.
I have seen many of my friends who have double teeth, where they have milk tooth and the permanent tooth together. Is it a normal thing, or what should we do to fix it?
Yeah, very good observation. It's you see, many of you must have had that before at your younger age, especially in the lower front teeth. When the baby teeth is still there, and from the inner side, your permanent tooth will erupt. So it's quite normal to have the two tooth, but you must visit the dentist immediately if you see something like this, or you can advise your friends to whom you have noticed that they have the double teeth in their mouth, because if the permanent tooth is already visible in the mouth, then they need to remove the baby tooth to let the permanent tooth come in in its own space. So they need to remove it immediately, the baby tooth.
Doctor, before you had talked about discoloration, so the front two teeth, why do they get discolored, and what can you do about them?
See, but discoloration means your tooth is dead now. Especially if it happened after the trauma. Sometime what happened when you are at a very young age, like 6 years, 7 years, 8 years age, and that time you had a fall, and that time nothing has happened to your tooth. And it was normal, as you have the only chip on your front tooth. But over the period of the time, like after maybe 10 years or 15 years, or sometimes some patients says after 20, 25 years, they notice that their tooth is getting discolored. Like they are getting yellowish or bluish, even brownish in color. So it means the internally tooth is dead. So you have to visit the dentist, and it needs immediate attention. We need to clean it up from the inside and fill it up. Not only from the, we can't do, in that case, we simply can't do the filling, as I said earlier to you. Like, so it's need immediate attention. If any of the, and even if it is not chipped, and sometime you noticed with your siblings or your friends that their tooth is getting discolored, immediately tell them, like, you have noticed that it's discolored and it's need immediate attention.
Thank you, doctor.
Doctor, while brushing, I have seen some like blood. Like when I spit the paste, I see some particles of blood. Why is it so?
Yeah, beta. Sometimes what happens, it might be the simple reason, like your brush need to be changed. You know, because you should change your brush at least after 2 to 3 months, maximum 3 months. Or even if you notice, like the bristles are frayed, like bristles are got damaged, then immediately you change your brush. Okay, so it might be the simple, because of the traumatic, you are brushing too hard and you are hurting your gums. It might be that one of the most common reason at your age is the trauma from the brush. Like if you are doing brush too hard and too long a period of time, so your gums get hurted and then they bleed. Another reason might be if there is some inflammation, if you are not cleaning your teeth properly and your gums get inflamed. They get some swelling, and if there is a swelling and you are brushing that time, that can be one of the reason. If you see that your gums color is changed, it becomes more reddened, more brightened, so then you have to notice that, and then you have to visit the dentist. But mostly for your age, it's a traumatic one. So every 2 months or 3 months, you have to change your brush.
Yes, doctor. So my brother is 17 and he had recently visited the doctor. So the doctor told him that he has to remove his wisdom tooth. So is it very necessary or important to actually remove the wisdom tooth?
No, it's not necessary. In fact, my 3 teeth, I myself have impacted one. It's completely inside the bone, and I'm quite old like now, but still I didn't remove them. It's not necessary, but yes, of course, if the dentist has told him to remove, there might be some reason. Like if you have the infection or inflammation of the teeth in the permanent teeth or in the wisdom tooth specifically, and you need to be on antibiotic because of the wisdom tooth infection, then it is always advisable to remove that. Another reason might be if sometime as your age, as you said, is 17, and if you need the braces and the space is less, or your wisdom tooth is it's not exactly in the place, and they are like sleeping position, like horizontally, they are not straight, and or they are the oblique, then it's can be cause of your other problems in your mouth. Then we advise to remove them, but it's not always compulsory to remove them.
I have yellow teeth. How much ever I brush my teeth are always yellow. So what's the precise age that I can whiten my teeth?
You know, you're too young now to do the whitening of the teeth. If you will brush your teeth properly twice a day, it will be okay. But if still, like after, we don't recommend at this young age to white your teeth, make the whitening of your teeth. But basically after 18, like maybe, if you really need it, then we will see. Like not before 18 at all. Okay?
Doctor, sometimes we get blisters inside the mouth. So what can we do about them, and why does that happen?
You know, reason for blisters are many. Like as I said, like for the bleeding of the gums, so like the same way, if the children are having this braces, because of that, because of trauma, if you have a sharp tooth in your mouth, your tooth is broken, they have cavity, and there are the sharp edges, that might be the reason of the blisters. And at your age, sometime because of the hormonal changes, you might have blisters in your mouth. So simply it's a very simple, when you have blisters in your mouth, simple home remedy is you can do the warm water with the salt, you can do the gargles, or if it's really bothering you, then you can apply the anesthetic gel is there, so you can visit the dentist and you can apply the gel on your blisters, and then it will be fine. But if it is standing for the long period of time, like for the months or and it's really bothering you, it's very painful, it's bleeding, then it's need to be taken care of, because many of our, in general body health, many of the diseases, they cause the blisters in mouth. Then they need to be addressed at the earliest.
Okay, Doctor.
Doctor, is there anything else you want to share with us?
Yeah, but I would like to share with you guys golden rules. Like I will talk about the 2 rules. First is 222. That's the basic golden rule for the dentistry, that you must visit twice a year to the dentist and brush twice a day for 2 minutes every time. So 222. Like twice a year you should visit dentist, and 2 times for 2 minutes brush your teeth. That's the one. That's a basic rule of dentistry. If you are doing that, you are good in every respect in your oral health thing. And second is, we call it 60 minutes. That's actually it's a golden rule, but if unfortunately if you are playing something and you see one of your friends or your own teeth come out completely, like if full tooth is out, and you get panicked, like what should I do now, or what should my friend should do now. So the very basic thing is just pick up that tooth, put it in the milk, and immediately rush to the dentist. If you are reaching to the dentist within 60 minutes of time, the same tooth we can reimplant in your mouth. Anybody, this is a very good thing you can share with all your friends. Like, I don't want it should happen to any of you or any of your friends, but it is good for the knowledge. Okay?
Thank you, doctor. We really enjoyed this informative session.
Me
Thank
too,
you, doctor.
beta. Thank you.
Wasn't it an interesting session? Thanks to Dr. Gurpreet and to all the children for joining us and sharing those oral healthy tips. So, concluding the discussion they had, we can say that oral hygiene is the practice of keeping your mouth free from decay and your other mouth structures free from infection, which includes cleaning of teeth at least twice a year to ensure good oral hygiene. 5 reasons why oral hygiene is important. It affects our overall health. Earlier detection of oral diseases prevents tooth loss, helps your dentist create an oral treatment plan and to have a whiter and brighter smile. With this healthy thought, program ਨੂੰ ਖਤਮ ਕਰਨ ਦਾ ਵਕਤ ਆ ਗਿਆ ਹੈ। ਮੈਂ ਉਮੀਦ ਕਰਦੀ ਹਾਂ ਕਿ ਤੁਹਾਨੂੰ ਅੱਜ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਬਹੁਤ ਪਸੰਦ ਆਇਆ ਹੋਵੇਗਾ, ਪਰ ਜਾਣ ਤੋਂ ਪਹਿਲਾਂ ਵਾਅਦਾ ਕਰਦੀ ਹਾਂ ਕਿ ਮੈਂ ਫੇਰ ਵਾਪਸ ਆਉਂਗੀ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਦੇ ਮਨਪਸੰਦ ਪ੍ਰੋਗਰਾਮ BMC ਪ੍ਰਵਾਸੀ ਵਿਜ਼ਨ ਰੰਗਲਾ ਪੰਜਾਬ ਅ ਕਲਚਰਲ ਹੈਰੀਟੇਜ ਵਿੱਚ ਇੱਕ ਹੋਰ ਵਧੀਆ ਜਿਹਾ ਐਪੀਸੋਡ ਲੈ ਕੇ। Till then, take good care of yourself. Sat Shri Akal.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
the exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.